live webinar because joining me and my pediatrician colleague, Dr. John Millette Alegria, is a guest whose work I have followed and admired for a long time, Emily Oster.
Hi, I'm so excited to be here.
Emily is an economics professor at Brown University, a mother of two. I'm sure you all know this if you're joining in, but let's just stick with me. She's a founder of ParentData, a platform built to help parents navigate the overwhelming noise of parenthood by using actual evidence. If you've spent any time in the parenting world, you likely know Emily from her presence on social media and her best-selling books, Expecting Better, Crib Sheet, and The Family Firm, amongst others. She has an incredible gift for taking dense, confusing data and turning it into something practical and far less intimidating for families. Her mission is simple. Parents deserve better tools, clearer guidance, and a lot less fear when it comes to making decisions for their kids. Emily created ParentData because she saw parents who desperately wanted to do the right thing, but were constantly caught between conflicting advice and expert opinion that weren't always backed by facts. What I love about your approach, Emily, is that it's not about finding the perfect way to parent. It's about clarity and confidence, recognizing that when we ask the right questions and have the right data, we can make the best choices for our own families. I specifically read through The Family Firm recently, and I love the line that within the process that you lay out, it's not giving certainty that we make the right choice, but it's about the confidence that we make it thoughtfully. So today we'll tackle very common issues that parents face every day with their kids and hear Emily's data-backed perspective combined with the pediatrician perspective. And we're all moms here, so I'm sure we're going to bring that perspective in as well. I certainly myself have gone down many rabbit holes that have taken up too many hours of my life, caused too many hours of lost sleep. So welcome, Emily. Welcome, Dr. Alegria. And let's get started.
Awesome.
All right. So topic number one. This is based on a lot of our experience and what we hear from parents. I'm sure you as well, Emily. You've written about how parents spend too much time overspending their worry on small things like rare complications or side effects, and perhaps underspend their time worrying about the common ones. When you look at childhood illnesses like the topic of this webinar, fevers, or things like rashes or I don't know, allergic reactions even, where do you think parents are overspending their worry budget?
So it's a great frame because I do think that thinking about a worry budget is right. And we are very drawn to sort of worrying about the things that are very salient. Parents, particularly when it comes to fevers, I think there's like this evolution of parenting, which I'm sure you guys see, where like with the first kid at the beginning, you're like really trying to titrate the exact amount of the fever. So I think one huge over worry for many parents is like, what is the exact fever number? And like, what is the best way to take their kid's temperature? You need to know if your kid has a fever because it tells you whether your kid is sick, but whether it is 100.7 or 100.8 is actually not important for how you are going to treat. And so I think a lot of this sort of initial, particularly in that space, is kind of like an overemphasis on details as opposed to the kind of sense of like, how sick does my kid seem? And I feel like this is something with pediatricians where they'll tell me like, your pediatrician asks you, well, does your kid seem sick? And parents are like, well, what do you mean? Of course they seem sick. It's like, no, but they seem like sick, or do they seem like I love to watch another episode of the Rugrats and like, I'm actually fine.
Yes. So Rugrats, I feel like
I don't know. I'm really dating myself. No, they do not. I would love to. When I said that, I was like, oh my God, that's literally no one's child is aware of.
That's okay. I mean, Bluey. Let's go with Bluey.
Let's go with Bluey.
Great point. So we definitely always ask that question. Does your child seem sick? Or like, that's what we want to know when they walk through the door. How sick are they? But to ask that question to a parent, they're like, what do you mean? Like, that's your job. Like they have a fever. So, but a sick looking kid, like that's what we say as doctors, a pediatrician, they walk into an office and it's like, the difference within a split second, whether this kid is sick or this kid is not sick. And sure, sick means like they have a virus, they're okay. that they are sick. They have something going on. They could be contagious. They have symptoms and signs of an illness, but they're not sick, I think is what I mean. Like they're not lethargic. They're not unable to get up. They're not able to talk. They are able to talk. They're not incapacitated.
I think what's interesting about this, as and now putting like a little bit of the parent hat on, is actually if you the first time you see your kid when they are really sick, is very telling. So my daughter, when she was 4, got a very bad virus, and it sort of like spiraled, and we got to the point where like she was dehydrated to the point of needing IV fluids in the hospital.
Mm-hmm.
And like when your kid is like that, it's like, oh, that's what you meant. Like that is what you meant when you told me that is my kid sick, as opposed to, are they kind of acting normal but a little crankier.
Yeah, absolutely.
But that's hard for parents.
It is hard for parents, actually. So Jamalette has a lot of experience working in urgent care and sees a lot of those sick and non-sick kids. But do you want to explain, because I know you recently caught like a really serious case where the kid was very sick. Do you want to explain what you see exactly in the office that makes you know?
Yeah, so it's like, how far away from normal are they? So, toddlers, 2-year-olds don't sit still normally, right? They're normally very active or very cranky and, just really active, I guess. So when you walk into a room and you see a 2-year-old laying down and not really fighting me, because 2-year-olds fight the doctor. They don't want us touching them. They don't want us around. So, when you see someone at that age or like a younger child who doesn't even fight when you're putting an IV in, who isn't kicking back, who isn't crying even, that's when we're like, this child is very, very sick. That would be the true definition of lethargic that I think a lot of parents use very frequently for like wants to lay on the couch and watch TV, and versus like truly is lethargic, where you're just really worried about them. And I will say, like, fever makes kids look pretty sick. Most kids look sick when they have a fever, and they're laying around. They're not as interested in playing. They're not as interested in eating. They want to sleep more. So that's very frightening to parents. But serious illnesses don't take a break when the fever comes down. So we give something, we get the fever down, and then the child, in urgent care, after 45 minutes after Motrin, they're sucking on a popsicle, they're running around the room, and they're destroying it, and they're ready to go. So when we see that, that's when we're like, all right, you're fine. Versus fever comes down and they're still laying there, then something more is up. And that's when we're checking labs and just doing other studies and trying to figure out what else might be going on.
Yeah. So would you say, Emily, that like parents are always worried about the fever itself? What from you hear the number, or like when they have to do something, what the right thing to do is next?
Yeah, I think parents so they worry about the number on the fever and getting that exactly right. And then I think we've actually arrived at a point where people are now a little bit unsure about how to treat this, and have gotten quite anxious about even the idea of treating. I think some of the legacy of some of the sort of current misinformation pieces out in the world has seeped into parents being like, well, is it really okay to give them Tylenol or Motrin? Is that going to like make something else worse? And I think then you're in a place where really the way the parents sort of should probably interact with this is just, okay, my kid has a fever, let me give them some Tylenol, see if they feel better. That's going to tell me something about what's going on. You're now having this additional thing of like, okay, well, is that also not good? I think the other thing that's happened for parents recently is people really want to know exactly what the problem is, right? So people will be like, how do I know and there are things you need to know, right? Like if there's a virus versus bacterial, that's like important for treatment. But most things our kids get are viruses. And most of the time, we don't know what the virus is, and it doesn't really matter. But I think because of the sort of one of the like unusual, surprising legacies of COVID is people think that we're gonna be able to like say what it is. You're just like, I don't know, it's probably like an adenovirus. Like there's a lot of viruses. Yeah. But people want, like, they're craving certainty in a way that like often is not really providable. And they often want to know why, like why can't, so that's a question I would ask you. Like people says, oh, why can't you tell me what the virus, it's not COVID, it's not RSV, it's not the flu. Can't you tell me what its name is? Is it adenovirus 40?
Right? Like what strain? How long is it going to last? And when can my kid go back to school? Yes, I agree. Well, so why can't we tell them exactly what it is? So there are tests that allow us to do that to a certain extent. But if you're a parent who went through COVID and that swab up the nose, like that's what it requires to identify a test. It's also expensive. Insurance doesn't always pay. And the big question is it going to change the outcome of how we manage this? Yeah. So no, usually not, unless we are in a spot where we really need to know. And in that case, we're usually testing. But we're always, for a virus, which is, as you said, the most common thing, we're going to do supportive care. We're going to help them rest, help them to stay hydrated, help them to not feel yucky, which, speaking of fever, we say treat the child, not the number. So we don't always need that exact number. We need to know how I always use the word yucky for kids. How yucky do they feel? Are they interacting with you? Are they getting up? Are they eating? Are they drinking? And so that number that I guess if maybe we can alleviate something here, the pressure of knowing exactly what it is, like I try not to even take my kid's temperature. It actually makes me crazier to know the number than anything. So maybe it's self-preservation, but yeah, if they don't look well is when I decide, do we need to medicate or do we not?
I will say people will come and they say, well, my daycare's got 100.4, cutoff.
I get that.
And that's true. Your daycare's got 100.4 cutoff. But if we are just talking about evaluating like how sick they are, your hand on the head is probably going to tell you low fever, high fever, and their behavior is going to tell you, treatment stuff.
Yep. I'm like the old grandma who does like the lips to the forehead kind of move. That's my move.
Yeah.
My kids really like to take their own temperature, particularly and so we have like an ear thermometer. And so occasionally I'll be like, I don't want to know. Like,
don't tell me. Keep it to yourself. Jamila, were you going to say something?
I was just going to say that's all so true. Like we just need to know, is there a fever? Is there not a fever? Like yes or no. And is the child uncomfortable or not uncomfortable? Because you can have a fever and not be uncomfortable. And then that's amazing. And that's great. Or you can not have a fever and be extremely uncomfortable. And then that's a whole different story. And we have to figure out what's going on there. So yeah, when we ask a simple question of when did the fever start and we get like a play-by-play of every single temperature over the last 5 days, like that's where it's like, I didn't need all of that. Thank you. I just needed to know how many days and when did it start.
I will say that I think one thing that parents could often afford to hear in this space is that it's not your kid's temperature from like endogenously, like sort of driven by them, is not going to get so high that they die. Right? I think people have this impression like, oh my God, my kid's fever is 105. And it's like, then it could be 110 and then like all their organs would shut down. Well, actually like, no, I mean, human temperatures can go up that much, but only with like, if you're taking like illegal drug, like that is not a thing that's going to happen as a result of a viral illness to your kid. And so it, like 105 is a scary number, but actually that's just a high fever. It's just a really high fever.
Right. I think
fear over like febrile seizures. Parents are very afraid that any fever is going to cause a seizure, and seizures are scary. They're scary for us. They're scary for everybody, but that's so uncommon. And yet it's such a fear in so many parents of like, what number do I need to go in for? What number is going to cause a seizure?
Yeah. Is it going to cause brain damage? Even if it's not a seizure, is a fever within itself dangerous? The fever is its body's natural way of fighting off that virus and is helping, and will probably, if the fever's there, will improve the clinical status of the kid, because it's the body doing what it's supposed to do to fight it off. There's a decent amount of febrile seizures that, like Gemma, you're absolutely right, like they're not common. I actually just had a friend whose 1-year-old daughter just had one, and she's like, this should be in a parenting manual, because it is so frightening when it happens. And as it is, of course, like you panic, you run, you don't know what to do in that moment. So it is good to be educated about, but like most people don't know about these things, or if they do, it's a terrible fear. That's perhaps the overspending the worry, because it's very unlikely to happen.
Yeah, there's a tension in almost thinking about sort of information and worry in a case like this, which is like, I would like people to be prepared, because I think if you're faced with a febrile seizure, you would like to know it's much better to have that information before, so then you know what's happening and you don't have as much panic. But if we tell everybody like everything that could possibly go wrong, then they are spending all of their time thinking about those things all the time. And so there's like such a balance. And I also think it's something people want to be cognizant of almost their own emotional reaction to information. There's a set of people who are like, I know I can read about all this stuff and I can hold it in my head. And, I'm not going to think about it all the time. And then other people are going to say, I know if I start reading about all the different things my kids can get, like, I am just going to be constantly thinking about, like, is it hand, foot, and mouth? Is it pinworms? Is it lice? Is it, this thing? Is it this thing? And like, then it's just like, you know what? Wait until your kids got the symptoms and then we can figure out what it is.
Yeah, it is a tough one. I would say the pinworms is a great example, which is like the symptoms for those who are listening is like, it's an itchy butt. So like every time your kid scratches their butt, you're going to think like it's worms, which is really bad. I mean, not the worms, it's like to have that in your mind. What?
People do get a lot of pinworms.
Yeah,
that is common.
I know. But I guess it's better not to think it's pinworms every single time your kid scratches their butt. Actually, on the topic, we did get an audience question. What age do you recommend, stop using rectal thermometers, knowing that's the most accurate one? Jamla, you want to take that?
Usually 12 months and under. I would not use a rectal over 12 months old, and even 6 months and over, you can get a pretty good estimate without one. I would say the infants are the ones where we care the most of having like the most accurate core temperature, right? I mean, in the urgent care will do it up to a year, never older, and even then, like only if the doctor asks for it. Like we've tried the temporal and it's like, I don't believe it. I don't believe that. Can you get a rectal? And then there's the fever.
What do you recommend? What do you recommend parents use? Like, I think people often find the head thing when they use the doctor quite difficult to get right at home. What do you like?
I mean, for infants, I always recommend rectal just because it is so important to know in a 1-month-old or under if they have a fever or not. We use the temporal ones, the forehead ones. I find them really inaccurate. I mean, my daughter didn't feel well this week. She's 12 and she came up to me at least once a day with the thermometer in her hand asking me to check, and I would do it 4 times in a row and it was a different number each time. So just because she wanted to know. And so I feel like it gives you a general idea. Like it was 99, so we don't have a fever, you're good, go on and do your thing. So yeah, I don't know, I don't like the ear ones. I feel like they're not very accurate.
I like the ear ones.
Do you?
I default to the ear with my kids, but the under the tongue I think is
that's the most accurate. But
yeah, I like
really
a lot.
to get a small kid to keep that under their tongue for a minute.
Right, when they could do it.
Yeah.
So I think what we've concluded is putting your hand on their head, that for an infant, you need a rectal. And then after that, put your hand on their head and make a general judgment about how warm it seems.
Yes. And, sometimes, because it's so important for us, sometimes when we have a child who's had a fever for several days, right? Once we get to 5 or 6 days and we don't have a really good answer, we want to know we want a little bit more information about what might be going on. And so in those cases, I really do want to know, was it an actual fever each day? Because parents will say like, oh, they felt warm, but it could have been 99. Like my daughter felt warm, but she didn't really have a fever. And so, while I do think that it's important to not necessarily focus on the number specifically and be really worried about that number, kind of knowing, do we reach the threshold for fever or not, at least once in a 24-hour period, to me is helpful information. Because once we're at day 6 or 7 of fever, I did not just say that, once we're past 6 days or 5 days of fever, we do want to get a little bit more information, because most viruses are going to give you 5 days or less, with exceptions. And so once we're past that, we want to try to figure out what's going on.
Because there's a likelihood that maybe it's not just a virus at that point and has developed into something bacterial, an ear infection, pneumonia,
sure.
Little kids, a UTI.
Yeah,
so
or
that's why
we're been that all along and we just assumed it was the flu. I mean, I've certainly had like little girls who came in with 5 days of fever and it's flu season, so everybody just assumed it was the flu, and she had a kidney infection. So once we're past a certain threshold of days, then we start wanting to know more. And so it's important for me to know, was there really a fever this whole time?
Yeah. All right, let's move to topic 2. This is a really great segue into the data on antibiotics. This is especially like a near and dear topic to pediatricians. I feel like we're the most the greatest stewards of antibiotics as when we can be, but data shows that we arguably overprescribe antibiotics as a society from decision-making standpoint. What do you think? Like, why do you think parents always would push for them, or they want like an immediate fix, or do you feel differently by the look of your face on that question?
I do. I have a couple of interesting things to tell you about this. So I think, generally, I think parents, like in our, in sort of my age group, I remember getting antibiotics all the time. Like, you showed up at the doctor and they were like, here's your antibiotics, and then we'll see you after this. Like, it was like any time you came in with anything that seemed like anything of respite, just like, here's some antibiotics. And so I sort of, like, I think many parents, having grown up in that environment, and kind of there's an expectation, like, okay, we'll bring your kid in, they're going to get antibiotics. And when they do, even if you give your kid antibiotics for a viral infection, there's a lot of positive reinforcement, because mostly they get better. Now, they were going to get better anyway, because the viral infection was going to go away. But the sort of way that this works for me as a parent is like, okay, you gave me the antibiotic and they got better. And often they will get better a little faster because the antibiotic will like lower the inflammation. And so basically, like, sometimes there's a little bit there, even though it's not really fixing. It's not like fixing the problem. So I think there's a lot of reinforcement that makes parents think that this is a good idea. And I will tell you, my husband has some work, and admittedly, this is on doctors in Sweden. But what they find is that doctors themselves, doctors' kids, doctors are much more likely to prescribe antibiotics to their own children for respiratory infections in general. And so that suggests,
I have a follow-up question though. What kind of doctors are these people who are prescribing to their children?
Just like, it's like GPs.
Okay.
And
like family.
Anyway.
I'm sorry, I got to push on it. Okay, family. So,
but this is anyway. But I think that's what's going on with parents. And then my sense is that then doctors, you tell me, but like that sort of, it must be tough when parents show up and they're like, where's my penicillin? Where's my penicillin? Like, why don't you just give me some penicillin? When we know that for most things it won't work. And even for things like ear infections, probably better to wait and see if it clears up before giving.
Yeah, medication. For sure. I will just say, as a parent, I'm a pediatrician and my kids, and this goes back to your last point of like, we know too much. So maybe that fear sits on us as a, like, I know what this can escalate to. And I'm more scared of those really rare things that happens in 0.01%. And I saw in my residency happen one time. We have such a selection bias in our head that maybe that's contributing. I don't speak for myself. It definitely does, but I withhold the antibiotics. But Gemma, do you want to run with that question?
Yeah, I mean, I think that like day to day, I see this is like a daily battle, I think, that we have where just yesterday, an example, 3 days of runny nose and we wanted antibiotics for a sinus infection. And this child who is like 8 years old and otherwise doing great, but she has a competition this weekend and she needs to be better for that. And we need to get her better. And it's just so hard to have that conversation because this is not bacterial. This is not going to get better with this antibiotic. Like there's not a lot of understanding of the risks of overtreatment with antibiotics. People think they're harmless. This is not like a street drug. I don't know why you're withholding this from me. Like, I just want to get my child better. And it's frustrating for us to, feel like we're fighting that fight every day, because then oftentimes they'll go somewhere else and get their antibiotic when we said no. But it is, as a parent, I feel very lucky that my kids didn't get a lot of illnesses that made me think they would need antibiotics at any point. They always just had regular colds, some ear infections. When they were little, we watched and waited as much as I could. Once they were bigger, I always gave them the choice. I'd be like, yes, you have an infection. It doesn't look terrible. We could give it a couple days, or if you're just really frustrated with it, we can treat you now. And most of the time they said we wanted antibiotics. I just gave them the choice just because they're old enough. It's their body, it's their pain. And I just didn't want to push that decision on them. But when they were little, I was all for not doing it if we could avoid it. So,
yeah, I think this is a place where I think the sort of education piece is helpful, because I do think there's a sort of mismatch where people don't understand, like, well, what is the downside? Like, why why not? Why don't you want to do this? And I think there's a little bit of like antibiotic resistance, which is actually a hard pitch to people because it's not really you're antibiotic resistant. It's kind of like, this is like, be altruistic. And it's like, actually my kid doesn't feel great. So they have a competition. Altruism is for later. I do think there's a sort of thing here about the microbiome, which I wonder if we could lean into a little bit more, which is actually like, antibiotics do not make you feel great. And so you may be trading like sort of nothing in terms of recovery speed for like 10 days of diarrhea, which is also pretty unpleasant. So it's not that I think we should scare parents and tell them like, if your kid has antibiotics, they're going to have terrible C. diff forever. But I do think there's a little bit of like, hey, this is actually not, a lollipop. Like this is a medicine and it has some side effects like any medicine. And so there is a value to waiting. And here is why it's very unlikely that these antibiotics, the other thing that my sense is can work is saying, hey, I'll give you the prescription. But like, let's try to wait to fill it. Your kid's got an ear infection. Like, it could be that this is the right thing. Why don't we give you the prescription so you have it, and then you don't have to come back. And then, why don't you wait, and give me a call in a day and we'll see if it makes sense to do this. And I think that there's a little bit of sort of messaging and realism there, because people don't want to bring their kid back in to see you again because they're busy.
Exactly. When I see patients in urgent care, my choice to provide the option of watchful waiting it just feels like not as good of a choice, because these people just waited 3 hours to see me. They paid a probably horrible copay. And then you tell them like, come back tomorrow if it's not better. Nobody wants to do that. So in those cases, most of the time they'll walk away with a prescription. When I really think that waiting is important, I'll let them know, like, look, just take this with you. If ABC happens, then go ahead and start it. Otherwise, follow up with your doctor in a few days. We're so lucky with Blueberry that we can follow up any second of any day, 24/7. So we do it so much more, I think, in this setting, because we are able to just follow up in 24 hours. It doesn't cost anything, and we can really see change. And we have seen so many ears that looked terrible day one look almost better completely the next day. So that's been really reassuring on my end that we're doing the right thing by waiting. But yeah, it's really hard in an office when somebody just waited forever to see you.
I think that's the benefit of telehealth, where you can check in as much as you need, as often as you need, and don't have to go, because going out of the home is and like a pediatrician being like a gatekeeper where you can't actually access what you think you need for your child's health is very anxiety provoking. So to have it in hand is helpful, even if you're actually going to do the waiting, knowing you have it as a backup. If your kid wakes up in pain or terrible fever in the middle of the night, you can use it. I think that's very helpful. But yeah, I kind of wish there was more data on the gut health part of it that we could quote, because I'm sure there will be, in the future, and maybe not far from now.
Yeah, I think that would be very helpful for a lot of people. It's also like a place where I think we could use more research. I mean, some people are going to take antibiotics. And so the question of, how do you then, like, there's a lot of discussion of probiotics. I feel like we could improve the research on that, so we could give people better guidance. Like, you're taking this antibiotic, this is this is the relevant probiotic, as opposed to saying, take whatever. Probiotics are probably fine most of the time, but surely could be improved. And I think that is a good case for probiotics.
Yeah. I think we're just like starting, this research has been, I think, going on for a couple of years, but we don't know even the half or even less of what the microbiome really does for our bodies. And like, those bacteria are involved in everything. They produce serotonin. You could have, like there's a lot that they do and produce, like for metabolic function and for mental health, that repeated courses of antibiotics really disrupt that and can lead to issues down the line. We just don't understand it very well, so I think it's just very vague, and most parents prefer not to think about it because they want their kid better today. So
totally.
It's hard to use as a case against it, but parents, I think, feel maybe they're doing nothing. Just to close this up, and we're not doing nothing by not giving antibiotics. Like, we're doing everything that we can in the best manner and thoughtfully with the information we have right now. And things just change and develop over time, and that unknown of what's to come, I think, is just a bit scary.
Completely.
Yeah. All right, let's go to topic 3. This one is it's close to home for me. I know Gemma too, because we discussed this earlier. I have a 10-year-old boy, a 7-year-old girl, and a 4-year-old girl, and sports and where to draw the line. So I know that, Emily, you've written about optimization and parenting, the idea that we feel pressured to maximize every decision. Youth sports is one of the biggest example, or a great example of this. Year-round training, travel teams, early specialization. I would love to get into the data about long-term outcomes for kids. Does specializing early give a better chance of success, or what's the risks around that?
I mean, this is I think we should sort of let me back out of this a little bit, because I think sports are one thing. We talk about the specifics of that, but I think there's this general, like, kind of extracurricular insanity that people have. And I really wish people would sort of reframe this a little bit, because there is some value in the data to extracurriculars. And you sort of look at, like, what are kids getting out of extracurriculars? A lot of it is like a sense of belonging. So when you sort of look at that, at literature, like, it can be really good for your kid to play soccer if they really like soccer, because then, there's going to be a period when school, like, something bad happens at school and they're sad and their friend at school is mad, but then they show up at soccer and, like, it's a different group. It's a group, like a place they feel like this is really like my people and I'm having a good time, and so on. And so that is such a value for kids to have something that they love. But it only is because it's something that they love, and you can get that without doing it 12 times a week. And for many parents, this sort of starts to become like, like, my kid's doing this for, so they can go to college for soccer, so they can be in the MLS, and that's probably not most of what our kids are going to get out of these extracurriculars. So really thinking about, what are the things that my kid loves and they're going to get these other values from, rather than, what's the sport that's going to put them in the best position for, college admissions, when most kids are not going to end up going to college to play sports, and they're definitely not going to go to the Olympics. I spend a lot of time telling people your kid's not going to the Olympics. And I will say the people who I know who are the most responsive and that agree the most strongly with the framing, your kid is not going to the Olympics, are my friends who have been to the Olympics. They're like, yeah, my kid's not going to the Olympics. Like, and I only went to the Olympics because, like, my parents didn't think I was going to, like, so your kid's not going to the Olympics.
That's a great perspective. I've never spoken to an Olympian, so I love knowing what they say.
Like, yeah, my kid's not going to the Olympics. So I think I would just like us to sort of think about extracurriculars totally differently. And unfortunately, that's the last thing I'll say about this, like, unfortunately, we have arrived at a place in the kind of world of extracurriculars where it's become much more difficult to do that, because all of these extracurriculars are like, there's a travel team, it's every weekend, and you can't just, like, play soccer for funsies. You have to, like, by the time you're 8, you got to play soccer for, like, seriousness, and that's sucks. I don't know how to fix that, but I feel like
sucks so much. And I mean, I feel like parents, like, so it's the money grab, but it's also parents who might believe their kids are going in the Olympics, or like they need to specialize early because they can get into college with this, that are almost leading the way there and pulling the kids with that. And I think it's a shame, because for funsies, that's all I think they should be doing too.
Yeah, it feels really hard to not specialize early with some sports that are year round. Like, soccer is all the time, right? My daughter,
it used to be just fall.
I know. My daughter is 12. She plays. There's a fall season. There's a spring season. There's even summer training. And she's playing at, not super elite, but elite enough that, like, if you don't do if you back out of any of that, then you won't be able to play on that team again. You're not playing enough to stay on par with the other players. And so it's really hard. 2 things are hard for me as a parent is, one, it's the only sport she likes. She's never been committed to anything else. This is the only thing she wants to do. And so everything sports-wise for her revolves around soccer. It doesn't leave time to do other stuff, really. Like, she wanted to try out for track, but it was going to be too much happening where it was going to overlap, and she would be doing track and soccer at the same time, which to me sounds exhausting. So she made the decision not to do that. And so it's hard when there are certain sports where it really is year round. And how do you still make sure that they have a well-rounded life and aren't spending all of their time doing this and not hurting themselves and causing injuries, I think is the big hard one. So
I mean, I think there's a moment for parents sort of early on and then in a repeated way for sort of families to sit down and, not every week, but like every 6 months and say like, hey, what is our schedule looking like? How are we feeling about this? Because I think one of the things that happens, sounds like not with your kid, but with some kids is we'll sort of get on the treadmill of some kind of elite sport. And then it turns out the kid doesn't really like it. It doesn't have to be sports, it can be music, whatever. It's like sort of eventually it kind of has like run its course, but now we're in this treadmill and it's like hard for anyone to say like, I want out, particularly when you've made these investments. But, sometimes you do want out. And so I think there's an opportunity to kind of, once in the fall, once in the spring, sit down and say, hey, like, let's look at how our time is being spent. Let's look at what we're spending, what we're doing and how we're feeling about it. Do we want to make any changes? And some of that may be changes by saying, look, everyone, my kid's really exhausted. Like they're not getting enough sleep. We actually have to change something to prioritize sleep or to prioritize school or whatever. Or it may be a kid's opportunity to say, I'm not loving this as much as I did before. Like maybe we need to change how we're doing things. And I will say that's very hard. My kids are not into this kind of competitive sports. My daughter was a very serious violinist. And when she entered high school, basically said, I want to I need to dial this down. Like I still want to play at school. I still want to play in the orchestra, but I don't want to take lessons anymore. And like, that was like, I found it tough. Like, she'd been playing since she was 5. Like she's quite good. She wasn't going to go to conservative. It's just like, there's a loss of like, oh my God, we put all this time into this, but I really had to listen to her and listen to what she was saying, which is I don't think I can do this at the level I want and fit it in with the other things that are important to me. And ultimately that's part of helping our kids make adult decisions and sort of trying to model the right kinds of decision making to think about our priorities, which is tough. It's hard.
Yeah, I think it's a great point to very actively and intentionally check in about the decisions that you're making moving forward every so often. It's a great point. We do know that with kids, specialization early on does lead to more injuries, and that those athletes who do become elite are usually those who did multiple sports in childhood. Yeah. I always get a kick out of watching like a professional hockey player playing soccer or like even a hacky sack, and like they're super good and coordinated because they've developed all the skills.
Yeah.
Yeah.
And I think, and of course, then there's the sort of sports question about concussions, which is the other thing parents often worry about, which is like, we have some new research out about football in particular that kind of is a dose response of time playing football and like, neurocognitive deficits. So I think if your kid's playing a high concussion risk sport, which would really be football, maybe girls soccer, actually, when they're heading, hockey, like it's sort of worth thinking about is there a way to minimize those risks?
Yeah, it's interesting that you said parents worry about this a lot, because I feel like around my neck of the woods, parents don't worry about it enough. Like they want their kid back out there as quickly as possible, even if there's been an injury, and it just breaks my heart, really. Like this child needs to rest and they just got a really bad concussion or a fracture somewhere, and they're like, no, but football, like he's gonna have to play this weekend, right? So
well, flag is up and coming, so maybe they can move on.
It's flag football.
It's all the rage.
It's going to the Olympics.
Is it?
That's one your kid might be able to get into because it's new. So you should consider, that's one to consider. One of the easier Olympic sports.
Or fencing, because nobody else wants to do it.
No, people do fencing. You're not right about that.
I missed that boat. Maybe our age.
Fencing.
Okay. Are there any others?
Any other easy Olympic sports? I don't think it's easy to go to the Olympics.
I was surprised by the characterization to begin with, but yeah, I think the flag sport is actually really, really fun and a great team sport.
Yeah, kids around I'm in Georgia. Kids around here play tackle football at like 7 years old. It's insane to me. I mean, they're all equipment at that age. Like they're just little bundles of helmets and equipment running around. But it's very interesting.
I bet lacrosse is one of the other ones.
Mm-hmm.
Yeah.
Yes. Plenty
Okay.
of
Let's move on to topic 4. This one is quite broad. I'm gonna start us off, and then Emily, I'm curious to see where you would take this. But the prevention gap, parenting versus system design. When we look at pediatric health outcomes, obesity, asthma control, developmental delays, mental health diagnoses, how much of this variation do you think is tied in preventive care access, early diagnosis, versus individual parenting choices? So, like, where do the biggest gaps actually show up in the data?
Can you
Yeah.
narrow that a little?
Yeah, absolutely. So there's a huge lack of access. So sorry, this is where my mind is at as a
Yeah.
pediatrician, worrying about access to kids for pediatricians. There's a huge gap of accessibility across the country. In the millions, I forget the number that don't even have a pediatrician within their county and have to drive miles to get to
Yeah.
one. So these long-term issues that could be prevented early on, I guess obesity could be one of them, but like as developmental delays, mental health diagnoses. A lot of them could be helped probably early. Perhaps it's access that's an issue, or social determinants of health, versus like specific parenting decisions or the way that they're handling things, like nutrition, let's say at home. Have you encountered like data around this large scale population health?
Yeah, so I think what's tricky is these things really move together. So, there is an enormous amount of inequality in the US, and, many people with fewer resources in the US have both less access to pediatrics, or, less access to sort of the kinds of careful pediatric counseling that you guys, for example, are going to be providing, and also have fewer resources at home to, say, think about nutrition, less access to fresh food in that particular example. So we're kind of like working with something where those two axes are moving so much together that it's that it's almost impossible to separate. What I will say, and I think this is on my mind all the time, because I sort of sit with like one foot in kind of, I think about health policy. That's like my original sort of research space. And then I talk to parents who are largely, in the case of the sort of parents in my audience, are like sort of well-educated, better educated people with more resources. Just that's the audience. And I think that I hear so much from the parents who I talk to, like, I'm so worried about this tiny thing. I'm so worried about this, like, I gave my kid too many goldfish, or, I did this and not this, and the toys aren't all wood, and what, like, sort of these parenting decisions where it's like, hey, man, that doesn't matter. That's not like, that's so minor. That's such a tiny thing. Like, don't worry about that. Whereas we aren't talking about some of these much bigger issues. How can we improve the sort of broad health of the population by, say, making school lunches better, or providing better access to telehealth for people, so when they can't get to the doctor, which they can't, they're actually getting their kid, at least seen early on. So we're kind of like over here talking about stuff that doesn't matter and not thinking about the policy for stuff that does. And that disconnect always really is on my mind a lot. I'm sure yours too.
Very much so. It's so disheartening. I mean, I could speak to school lunches. I'm very much hoping that this new food pyramid trickles down to change policy there, or to just, whether it's, I've tried to influence, let's say, like my kids' school lunches, and they have to follow these very, very strict regulations that come directly from that pyramid.
Yes.
So I'm hopeful that that will change a little bit. I don't know how many kids will be motivated to like pick up the string bean or the meatball.
I mean, I feel like we could talk forever about school lunches. I have such feelings about them, but I think one of the things is like, for most kids in the US, this is actually the healthiest meal they're being offered every day. And so there's like an enormous amount of opportunity with this. And yet, if your idea about like, we're going to provide vegetables is like, we're going to provide like just a giant carrot and like an apple, and tell kids they have to put them on their plate, guess what's going to happen? The trash is going to be full of carrots and apples, which is in fact exactly what's happening. So it's not enough to say, here's the regulation. You also have to like cut the apple into slices. Maybe you serve it with peanut butter, like, you like make it fun. Like we have to we have to think this is important and invest effort into it. We can't just like, write down some rules, which the rules that we have are fine. And they're not fine. They could be better, but like it's the translation also. Anyway, that's a little off topic. I feel strongly about school.
No, I love talking about this. I could ask a million questions and move forward with that too. But no, I appreciate that perspective. Gemma, anything to add there?
Yeah, just thinking about like when you said that about the wood toys, and when my daughter was little, I was always so overly worried about like how much sugar she was getting, and like the plastics and all of these things. And yes, I feel like we can definitely spend a lot of worry on those things, but like making sure her car seat is installed correctly and that it is the right size for her, and stay rear facing as long as possible, and like car safety, bike safety, like those kinds of things, like that's where a lot of injuries and deaths happen to children. And this is where, like, if we all put more focus on some of these other, wear a helmet when you're on something with wheels, put your seatbelt on, those kinds of things, I think carry so much more weight when we look at population statistics and kids.
Pool fencing.
Yes.
Pool fencing.
Yes.
Absolutely.
Water safety in general, all of,
Gun safety.
Preventable.
Guns. Yes.
Yeah. So again, it's like that placement of anxiety around the things that are not impacting us largely.
I think our anxiety in general, I think anxiety responds really strongly to salience. And so like if you've heard about something, then you're worried about it. And part of what happens in the news cycle and the social media, but just in general, is like things that are unusual get reported because like they're unusual, they're surprising. Like, we're not just going to be like more people died in car accidents today, more people died in car accidents. Like, even though every day more people die in car accidents. And so in some sense, like it's so common that it's not novel, and then you're not thinking about it, even though you're worrying about something which is definitely not that important, or like much, much less important than this other thing which you're not hearing about. I think that's just part of how worry works.
Yeah, I think this is what a lot of your books are really trying to help to do, though, is like put this in perspective of like, let's focus on what we really should be focusing on as parents. And there's so much to worry about. So like ease up, like give yourself a little grace on those issues, which, will make a little impact, and let's just focus on the big ones, which are probably easier.
Yes. Yeah, where there's more action items. And a lot of these things you should be worried about. It's like, get a car seat, wear a helmet, like, make sure you're wearing a seatbelt. Like that stuff you can do that has like measurable giant impacts on your chance of survival, in contrast to some of the things people are doing, like feeding their baby butter or whatever, which is not important. It's fine. It's fine.
Okay, I'm going to try. I missed a few questions above. I'd love to go back to. Okay, let's see what I got. Any recommendations for kids and parents getting sick? For example, should one of the parents try to quarantine when the kid gets a contagious sickness, for instance, the flu? The word quarantine is like gives me PTSD to begin with. Emily, I'll let you take that one.
I want to hear what you guys think about this. I always tell people this is a waste of time, but sure. I'm curious if you would not say that.
No, I very much would agree. I think what I've also learned as a parent is that life goes on. Like you can't react extremely to something that's going to change the course drastically of like the life flowing for you and your kids. Like we live in reality. Someone might get sick, and even if there's things you could do for it, there's ways to prevent contagion, but to quarantine and completely separate and totally throw off the flow of a family, I think is very, very difficult, and something I don't recommend. I mean, wash your hands, clean surfaces, try not to sleep on top of each other face to face. Like those are the things I would say.
Yeah. And if you're sick, stay home. But if you're not sick, you can do what you got to do.
All right. We talked about the rectal thermometer. After how many days of fever should a child be evaluated by a doctor? Gemma, I think you mentioned this before.
5 is a big ticket number. Yeah. 5 or more is where we usually say at that point you should.
Yeah.
It depends on whether we know what's going on yet or not. So flu can cause 7+ days of illness or fever, and we don't always worry about it if we know that you have the flu and we know there's nothing else going on. But 5 days is pretty much my number. If it's fever alone and nothing else, it might even be 3, because those are the kids who might have a UTI or might have strep and they just don't have the other symptoms, and these are things that will need treatment versus if there's other symptoms and it's a cold and they have a fever with cold symptoms, then we can let it go to 5.
And strep requires a strep test to prove that antibiotics are warranted. So we don't want to be treating unnecessarily.
Even if everyone in your house has strep, you need a strep test if you have symptoms.
That's the newest recommendations. Yeah. There are home strep kits that you can get that do the rapid, if that helps. All right. You mentioned that high fever alone typically isn't dangerous. When would it become serious enough to require an ER visit? I like this question. So things to look out for. What?
Like the number?
No, I think that's interpret it how you want.
I thought that question was asking, is there a number at which you would go to the ER, for which I would have said
there's no number.
No number.
For me, it's how the child's looking and how they're acting. So there's a lot of fear around not being able to bring a fever down. I don't care if you can't bring the fever down. I really don't. If the fever doesn't come down, that doesn't necessarily mean that this is a more severe illness. It just means that the fever's doing its job really, really well, and that the Motrin or Tylenol is not bringing it down. What I care about is, how does the child look without a fever? So if I can't evaluate that, if we can't get the fever down to see what the feverless child looks like, then that's when I get a little bit more worried. So if we're 105 and we stay 105 after trying all the meds and the child's looking pretty icky, then yeah, go ahead and go in, because there may need to be more stuff done and more tests.
And an infant with any, this is something I tell, like an infant with any fever needs to be seen.
Thank you. Yes.
8 weeks or earlier, any fever whatsoever needs to be seen right away.
Right. And so when we say infant, it's depends who you're talking to or like where you are, access to medicine. 3 months and under to be safe, really, definitely 2 months and under. Those are the kids that we very much worry about, because babies do not present normally where you would expect they would look bad, or they can be very tricky, and missing a serious infection in babies that little can be just life-altering, very scary, dangerous. So that's why that is a true emergency.
Don't trust infants.
Thank you for bringing that up. Yep, don't trust them.
Yep, don't trust them at all.
I got one more, aside from my brother sending in comments about lacrosse. Okay. What are must-haves in your medicine cabinet or on-the-go emergency kits? This one I love.
Good question.
I will tell you what I have.
Yeah.
I have Tylenol, Advil, pinworm medication, as per earlier discussion.
That's amazing.
And those are really it. I don't know what that tells you about my house. We don't. That's basically all we use.
Yeah.
That's great.
I think about it like, what do I take with me if I'm going to travel? And so it's always going to be the ibuprofen and the Tylenol. I usually bring something for diarrhea for the older kids and adults, just because travel, and something for nausea. I like to have on hand, just because you don't want to be that when you're.
I actually have a little pill. I will say I have a little pill thing in my backpack, and the 4 things in it are Pepsid, Advil, melatonin because of travel, and Zofran.
Yeah.
And Zofran. Yeah. So Zofran's the anti.
Zofran's an anti-nausea.
Definitely having some melatonin is helpful. For a while, I carried lice medicine too, because on one trip my daughter had lice, and I was like, this is the worst thing in the world. So I didn't travel without it for at least 2 years after that.
Yeah. I'm trying to think if I did anything differently. I mean, my kids had an allergic reaction when just like
Zyrtec, Zyrtec.
A rash kind of thing breaking out, not like an EpiPen worthy, but yeah, probably something like the Zyrtec is helpful for, if you're just worried about it, but very unlikely to have to use. All right, we are almost at the top of the hour, so I'm going to wrap this up. Emily, thank you so much for joining us. This was so fun. This was so fun. Yes, really appreciate it. Do you want to just tell everyone about like where they can reach you?
Yeah, you can find me at ParentData.org, where I talk about a lot of these things, or you can find me on Instagram at Prof. Emily Oster, where I also talk about a lot of this stuff.
Great. Awesome. And we are at Blueberry Pediatrics, www.blueberrypediatrics.com, or all of our handles are Blueberry Pediatrics. So if you ever need help and access to a pediatrician, we're available 24/7, 365. Again, thank you. This is so fun. Jamila, thank you so much for joining us.
Thanks for having me. This is awesome.
Thank
It was so nice
you.
meeting you, Emily.
So nice to meet you guys.